This has been quite a, on one hand, lucky situation, on the other hand, a bit unlike very not so nice for the patients. So we were just in the process of starting a rehabilitation program with a baseline assessment at the end of 2019, early 2020. So we had completed an assessment of a group of patients who were supposed to undergo water rehabilitation. And unfortunately, due to the COVID outbreak early 2020, we were not able to start that program because swimming pools and thermal pools were closed. So we followed up this group of patients, and we found that they were, through our multidisciplinary team, we gave them suggestions about movement and the ability, to compensate for the lockdown. However, at the end of the lockdown period, we detected an increased number of falls and more postural instability. I think that this has been somehow related to the fact that the people were asked not to leave their homes and maybe just walk briefly during the day. And so this, on one hand, increased the likelihood of falls at home. We know that Parkinson patients suffer from walking in narrow holes, and maybe if there are carpets on the ground or obstacles at home, that puts them a bit at risk of falls. But also the lack of training, the lack of ability to exercise has had an impact on the walking skills, and also maybe has potentially reduced the efficacy of levodopa. We know that to keep a very good levodopa absorption into the jejunum, you need to keep the patient mobile, and this was not possible, unfortunately, during that lockdown period. So to conclude, I think that just being in touch with them, their quality of life did not deteriorate much, but we saw more postural defects at the post-lockdown assessment, and overall a greater number of falls during that period.